my screen stops or anything like that. But we'll get started now by going over today's session and what we're going to talk about. So my name's Jack. I'm one of the student recruitment managers here at City St George's, and I focus on our Tooting campus based at St George's Hospital. So in St George's, we offer a wide range of healthcare, science and medicine courses. And today I'm here to talk a little bit about medicine, alternative routes into medicine if you've not been successful this year, or if you're thinking about taking a slightly different route, and then alternative courses that you might want to consider, especially some of the science and healthcare courses that can really set you up well for studying medicine in the future or just being involved in sort of healthcare and that side of things. So we're going to get started by talking a little bit about who I am, who the university is, just so you've got a bit of an idea of the kinds of questions that we can answer. Then we're going to talk about medicine in a little bit more detail, the course structure and how to apply. I know some of you will be aware of this already, but hopefully there's a few things that you might learn there about graduate medicine and some related subjects. We're then going to talk about the bulk of today's session, which are these alternative courses that can set you up really well to go into medicine later in life or follow a similar career sort of later on as you're progressing. I'm going to finish with some resources that you can have a look at and also talk a little bit about clearing this year. If any of you have already got your results, if you're taking a gap year or you're a mature student, or if you're anticipating results this summer, I can tell you a little bit about how our clearing process works and which courses are likely to be open this year. So hopefully, as most of you know, City St George's has two campuses. One of them is based in South London, joined to St George's Hospital. It's a dedicated healthcare, medicine and science campus, meaning that we work really, really hard to support students interested in joining the NHS or working in related careers. Our university is a little bit different. Because we're joined with a hospital, it means that all of our courses, even our healthcare and science courses, often have quite a big clinical focus. You're getting to work with NHS doctors, many of whom actually teach in our courses, and you're also getting to be in a hospital and healthcare environment from day one. If any of you have watched 24 Hours in A&E, it's all filmed at St George's Hospital, and so it's a really exciting environment to learn more about healthcare, about medicine, and about biosciences. As well as that, it's still a fun campus. We have a students' union and a bar and lots of societies, so you can always get involved in that. But it is really, really focused on those students that want that quite specific medical and healthcare experience whilst at university. So part of my job is going to schools and colleges around the country alongside my team to talk a little bit about studying medicine and also studying other healthcare courses. And one way that I always like to start is by asking whoever I'm presenting to why people should study medicine, and more importantly, why people shouldn't study medicine. Now, I'm not asking this to put people off medicine. It's an incredible course, and if you're able to get on and progress, it's a very, very fulfilling career. But there's also lots of reasons that medicine can be really, really difficult. And applicants for us who are successful in applying to medicine are the ones that understand both of these things. It's not people that think it's going to be super easy and they just want to get stuck in without understanding the sort of more difficult parts that they can expect over the coming 5 or 6 years. So start with all the good things. With medicine, you get to help really, really vulnerable people and, depending on which area you're in, save or improve lives. It's perfect for anyone interested in science or learning more about biology and specifically the human body. Provides you lifelong career prospects, regardless of what happens in the NHS and in the country. We're always going to need doctors. And so you have that job sort of for the rest of your career. As well as, being a doctor more generally, one of the nice things about medicine is it allows you to specialise even once you're on the degree. Becoming a GP or becoming a psychiatrist or becoming a neurosurgeon are all incredibly different degrees. And they're incredibly different careers. And so you're able to specialize later on in your training and find what really, really suits you. Big reason that people like medicine is that it's really practical. Although there will be a lot of science, you'll have lectures, you'll have exams, all that standard stuff. It's also quite hands-on. You'll be doing clinical skills from really early on, working with patients within your first couple of years. Those are the good things about medicine. Some of the things that might put people off, why maybe they wouldn't want to study medicine, and things that you should be really aware of before you apply to medicine or healthcare degrees. The firstly is medicine is incredibly competitive. We normally have around 1 in 10 applicants for every place on our med school, and we're not the most competitive medical school in the country. So it is a difficult application process with extra steps that we'll go through in a sec. And so you need to be really confident that you're willing to put that work in and understand that even really strong candidates often get rejected and may reapply. Lots of our students applied for medicine multiple times before they actually received that offer, and so you should be prepared for that. In terms of the course and the career afterwards, it's not always plain sailing. Although we have plenty of support for our medics whilst they're on the course, and the NHS does provide lots of support when you're in your training and become a doctor, it is a stressful job. It's a long course, taking at least 5 years, and there is quite a high, heavy workload. So again, you should be prepared for that. Be prepared that you might not be actually working and earning for 5 or 6 years after you join. As well as that, some obviously difficult things in medicine is you are dealing with really difficult situations, supporting patients and their families and friends through some of the worst times in their lives. And for you, that means that you might not always be able to engage in sort of the wider things that other people can. Doctors generally work on social hours and evenings and weekends, and so it's really, really important that you sort of prepare for that as you go into it. Like I said, I'm not saying this to put you off. I'm partly saying it because it's really important that you understand that for the interviews and for your personal statements. But also, you might be saying, actually, I really don't want to deal with that application process, or I don't want to be in medical school for 5 years and then training for a few years after that. I'd rather just get stuck in. I'm more interested in science and the human body. We'll have some alternative courses that you can think about a little bit later on. So let's talk about medicine to start. Like I said, we're going to be talking about alternatives and other ways of getting into medicine, but I think it's important for all of us, just to make sure we're on the same page, to talk about medicine more specifically before we start talking about these alternative courses and alternative pathways. So medicine itself, to become a doctor in the UK, you have to take one of two routes. Either you can apply as an undergraduate, and that's where you'll take an MBBS course. So that's a 5 or 6 year medicine course that you take after your A-levels or equivalent. You join the medical school, you study for 5 years, split across placement and university, and then you qualify as a doctor and go into your foundation training. That is the most popular route to becoming a doctor in the UK, but it's not the only route. The two other routes that we're going to talk about a little bit today are the apprenticeship route. That will be an individual NHS trust, and it's normally for people who've been working in the NHS or in healthcare for a number of years, and also graduate medicine. So graduate medicine on the right here is a 4-year course, so it's an accelerated medicine course, and it's specifically for people that already have an undergraduate degree, normally in a relevant subject. The reason why we're putting this right at the start is to help you understand that if you don't become a doctor straight after A-levels, if you don't become a doctor as your first university course, there's still a route open for you to get into medicine a little bit later on if you still want to. So when we're talking about alternative courses later on, keep in the back of your head that lots of people go on to that graduate medicine course later in life, become a doctor, and are able to work in medicine. Lots of people also don't. They decide, I've done my biomedical science course or my paramedic course, and actually now I want to do a different career. The nice thing to remember here is that if you hate the UCAT or you just can't apply and you can't seem to get a place, there are alternative routes in later in your life and later in your career. Let's talk a little bit more about the 5-year course, just so you can get a bit of an understanding of what that course looks like and how it's sort of structured. Now, every university will be slightly different, but this is the way that we structure our course. So your first 2 years are when you're understanding the structure and function of the body. They're the slightly more academic years. We call these the clinical science years. And it's when you're learning all of those skills and all of that knowledge that you need to go out on longer placements and actually be working with patients and with fully qualified doctors. Although these are the more academic years, you'll still be going out on sort of shorter clinical and community-based placements from year 1. Like I said, we have a very clinically based course, so it's really important that you get out and about as quickly as possible, and we support you to do that, organising all of your placements. This is also where you'll get to use our in-house dissection room and take place in case-based learning, where you'll be considering anonymised but real cases, so you can use all of that knowledge you develop in your lectures and classes to actually apply them in a sort of medical environment. In the third year, we shift from that lecture-based activity to a combination of problem-based learning, where you've got longer-term problems that you're using all that knowledge you accumulated in first and second year to tackle these problems, and also student-selected components. We give this year the name Transition Year, as it's really here to prepare you for that change in learning style. That's also where you have your first bigger placement. So we normally have 5-week blocks in medicine, surgery, and general practice in that third year, and what we call the T year. Students also have the option to intercalate. Some of you might be aware of what this means, but after your second year or after your third year, you have the option to pursue an additional undergraduate degree on top of your medical degree. This is where you could go study a specific topic like the science of reproduction, behavioral medicine, or global health to set you up for a career in that in the future. For us, it's totally optional. At other medical schools, it is mandatory, but it's basically allowing you to top up your degree so that you have an extra full undergraduate degree alongside medicine. It can be really, really useful if you've got a specific specialism that you want to go into. In the fourth and fifth year, you're on a lot more placements. So you'll be rotating through a series of clinical placements throughout both years, as well as taking some final really important exams to prepare you to go into your foundation training. After that, you've finished university and you become a resident doctor, previously known as a junior doctor. So after you graduate, after you've completed that medical training, you go into core foundation training. Now, this will also be a series of rotations where you're going around different NHS hospitals or clinical or community placements, working in the NHS as a resident doctor. After that, you go into your specialty training, and this is where you decide what type of doctor you want to become. The number of years that it takes to go through specialty training can really vary. If you want to become a GP, it might be 3 years of specialty training. If you want to become a neurosurgeon, it can be 8, 9, even 10 years. So it's really up to you here where you want to go. But it's important to say, even though you're still sort of training, you are being paid your salary at this point, and you are a doctor, even if you're not sort of fully specialised in your area. You can find more information about this on the British Medical Association's website, the BMA, but it's really, really important that you have an understanding of just how long this sort of pathway is to becoming a fully specialised doctor. The longest route to becoming a specialist doctor is a maxillofacial surgeon. It can take around 19 years to become a consultant compared to normally 10 or 12 years max in sort of other areas. So like I said, it can really vary and it can be quite a long path until you're sort of a full consultant and fully specialised. To give you a bit of an idea of what the undergraduate degree will look like in terms of teaching, especially in first year, we are really, really big on clinical skills and communication skills. This could be you learning how to take blood pressure, how to insert a cannula, measure heart rate, and other really important skills that you'll be using on your placement. Once a month, we also have communication skills workshops where you get to work with actors to develop your bedside manner and further communication skills. We have case-based learning in first year. This is when you're given a clinical case to review alongside your fellow students and come up with a diagnosis or some recommendations. And they're facilitated by dedicated staff that just work in clinical and problem-based learning. We do have lectures throughout the week, and often we'll invite guest speakers, doctors, or other healthcare or science professionals to work on that. And this is one of the really nice things about having the close connection to St George's, is we have that link to the NHS from sort of day one. Although I said earlier that medicine can be really, really difficult and quite an intense course, we do make sure that all of our students have time to relax and take part in extracurriculars. So Wednesday afternoons are always free time where you'll get to either join a society, relax with friends, or sort of do a little bit of homework. If you want to learn more about student life, you can have a little look on our website, and also on our website, citystgeorges.ac.uk, you can chat directly to our students. So we have an option for you to chat directly to a student studying medicine or whichever course you're sort of interested in. So to run through what the sort of application process looks like, as I said, for medicine, it's quite a long process. It's really important that you have either work experience or some alternatives to show why you're interested in the course, and that you really understand what it involves. You have to take an aptitude test called the UCAT. This is unique for medicine, and our other courses don't require an aptitude test, and it's really, really important that you get a high score. You've got an earlier UCAS deadline of the 15th of October this year, and you have an interview. So, like I said, the application process for medicine is quite intensive and has lots of extra steps. And generally, the reason why we've added all those steps is because it is a very competitive course, and lots of people apply with top A levels or already having a degree. And so we need extra steps to sort of narrow down who we're going to give the offer to. As well as that, we will have sort of generalized entry criteria. So you need to be studying biology and chemistry, for example. You'll have to write a personal statement and you'll need to provide an academic reference. So like I said, it's quite an extensive process for medicine. And again, it's worth thinking about whether you want to go straight for this as an undergraduate course, or you'd rather study something else or look for an apprenticeship in order to sort of progress onto the course a little bit later on. In terms of what the UCAT looks like, it's a 4-part clinical aptitude test that looks at your verbal reasoning, decision-making, quantitative reasoning, and situational judgment. You need to get 500 in each of the first 3 sections, and you need to get an overall score. We anticipate the overall score in 2026 will be around 2,000, but it depends on sort of the average score of our applicants. And this is how we decide who gets an interview. So you need to set the UCAT and you need to get above our cutoff in order for you to get an interview. In terms of the interviews themselves, we use MMIs, so multiple mini interviews. That's where you go around different stations, each asking a different question, trying to understand why you're interested in the course and whether you've got the aptitudes that you really need to succeed in medicine. Lots of our courses do use MMIs or other styles of interview, but again, medicine has that sort of extra level just because it is that much more competitive. It's important to say for all the interviews, they're never really testing your scientific knowledge. We've got your A-levels and GCSEs for that. Instead, the interviews are looking for those skills that your A-levels and that the UCAT don't test for. So your communication skills, your empathy, your ability to work in a team and stay calm under pressure. That's why the interview is there, to test those sort of extra skills that are really, really important to us. In terms of our grade requirements, you need to get at least 3 A's at A level, and that must include chemistry and biology. If you're not studying A levels, if you're studying an alternative set of qualifications, then we will accept those, and you can find out a little bit more on our website of exactly what that looks like. We also have GCSE requirements, so you have to get a 6 or above in English language, maths, and any sciences that you took. So again, it's really important that you reach these criteria. We generally can't consider anyone that missed it unless you qualify for a contextual offer. So our contextual offer knocks off 2 grades from any of our standard offers. So if you apply for medicine, that means it can go down to ABB. If you apply for a course like Biomed, it can go down to BCC. So it's really important that you check whether or not you might be eligible for our contextual offer, because it can sort of lower your grades that you need to get in. It can be a really great way of joining the university, even if you just miss out on your offer. So now that we've covered medicine, sort of a whistle-stop tour, I am happy to take questions about medicine later. We're going to talk about some alternative courses. It's important to say before we get into this in more detail that these are really, really incredible standalone courses, but like I said, they can also open up a pathway to getting into medicine a little bit later on. So if you're really struggling with the UCAT, or if you miss out on those quite high grade requirements for medicine, it is important to consider these alternatives in order to see if you might be able to progress onto medicine after you've completed the degree when you go on to do graduate medicine or sort of further study that way. So we're going to start by talking about allied health professions. So these are all the other healthcare professionals that work within the NHS that aren't doctors. These represent another route into working in healthcare and ticking off a lot of those boxes that medicine gives you, being able to work really closely with patients, having an interest in science, being able to save lives. These are perfect for those looking for really, really specific careers within the NHS. You still got that guaranteed job and really good job prospects sort of going on. The application processes often aren't quite as competitive or intense. We're still looking for really high quality applicants, but you don't necessarily have as high grade requirements, and our average offer rate is often quite a little bit higher. Both allied health professions and science-based courses share a lot of those similarities on why people want to go into medicine without maybe so many of the negatives. Now, we're not saying that everybody wants to go into allied health or that it's easier than medicine. They all come with a lot of difficulties and they can be really, really intense courses, but it can be a good way to consider an alternative if you've decided medicine isn't for you. As I mentioned earlier, it's also important to do this anyway in order to improve your medicine application. One question that lots of universities love to ask is, why do you want to be a doctor rather than X, rather than a biomedical scientist, rather than a nurse, rather than a paramedic? Understanding the alternative courses and careers on offer will mean that you can submit a stronger application for medicine. And who knows, you might find that actually you're more interested in this alternative career, in this alternative course. So we're going to be talking about healthcare courses for the next 10 minutes or so. And I wanted to start by talking about the concept of an MDT. So MDT stands for multidisciplinary team. And that's essentially everybody that comes together in a clinical environment to support a patient. It can include doctors, it can include paramedics, it can include nurses, physios, healthcare scientists, and loads of other people. There are 1.7 million people working for the NHS, and just under 10% of these are actually doctors. Everybody else that goes into that clinical side is part of that MDT and is working with doctors and with other healthcare professionals to improve the lives of patients. There are over 350 careers in the NHS. We want to talk about a couple of them in a little bit more detail, but it's important that you understand just how diverse the NHS is and whether there might be a course out there for you or a career out there for you that can tick off the boxes of what you were looking for with medicine and potentially can also be an alternative route in the future. So we're going to start by talking about one that you're probably all aware of, which is paramedic science. So paramedics provide that really important emergency pre-hospital care, but also can work in hospitals, can work in schools, can work at venues. There are often paramedics based in St. George's, and some of them will be going out in ambulances, but some of them will be working in that hospital environment. At St. George's, we have a really thriving paramedic course. We have a simulation suite with 2 full ambulances in our basement. If any of you visited on the open day, hopefully you got a chance to see that because it is really, really interesting and really cool, as well as a virtual simulation suite that mimics a ward, but also emergency situations. So we have a room that can fill up with steam, there can be lights, there can be noises, to try and imagine what it's like actually supporting a patient in that emergency environment. Paramedic ticks off loads of those things we talked about earlier of why medicine is a great course. You're getting to save lives, you have to have a good understanding of science in the body, and you have a guaranteed job for life, whether in the UK or abroad. During the paramedic science course, you'll also spend lots of time out on placement. Roughly 50% of your time is spent on placement during paramedic science, so you are out and about in between quite a lot. Next, we're going to talk a little bit about the radiographies. So most of you have probably heard of radiography before. We have 2 radiography courses at City St. George's. We have a diagnostic radiography course and a radiotherapy course, otherwise known as therapeutic radiography. Diagnostic radiography is all about using imaging to diagnose and treat patients. You'll get to use really, really interesting technical tools like X-rays, ultrasounds, MRIs to diagnose patients. Again, working on that wider MDT to focus on how a patient ought to be treated moving forward. Again, we have a stimulation centre at St. George's and also a digital imaging suite. So you're getting to practice with all of these technologies before you go out in placement and before you go out and work in the NHS. Again, you spend roughly half your time actually out on placement. This is really great because, again, the NHS is in desperate need of more radiographers, and so you're able to work across the country in this area. You get to really use your scientific skills here as well. So if you really love biology, but the idea of working really on social hours or the idea of working in those like particularly high stress environments doesn't suit you, then a course like radiography, where you're getting to use all your scientific skills, look at and work with patients in a lot of detail and hopefully save and improve their lives, but without some of those negatives in terms of unsocial hours, this could be a really great option for you. Physio is another course that we have here at City St. George's, and again, it's one of our more popular courses. You probably all have a bit of an idea of what physiotherapists do. They treat a range of conditions with a range of patients. You could be working with children, or you could be working with elderly patients, you could be working with people in recovery, or people that just need a little bit of support. People often think of physios in terms of working maybe in geriatrics and hospitals with older patients, but actually there's a really diverse range of physios that work all across the country, whether it's in sports clubs, whether it's in communities, whether it's in schools, whether it's in children's hospitals. And so you do have a really wide range of careers afterwards, even within physio specifically. Physiotherapy is also a great way to start your own practice if you want to work privately and you're interested in business. Lots of physios that have graduated from us have went on and founded their own clinics. At City St George's, one thing that we're really proud of is we are able to offer community placements. This is relatively rare in the UK, but we have optional placements that can take place in schools, charities, or sports clubs. So if you do want to work in a different environment to the typical physio, then our course is really well set up. And lots of our academics came from that area, and so they're able to support in getting into, say, working for a football team or getting involved in sports physio. Last couple of allied health professions that we're going to talk about. The next one is occupational therapy. This is an incredible career and an incredible course if you're interested in supporting patients after they've been through some of the more difficult times in their lives. You're often trying to improve their ability to perform sort of everyday tasks, and you can work in a much more diverse range of settings. Occupational therapists will work in care homes, they work in the home with patients, they work in hospitals, in schools to try and improve the quality of life. One nice thing about occupational therapy is you can really see the difference that they make with their patients firsthand. We have an Art of Living suite in the university, so you actually get to see what it's like for someone to go through recovery or an illness at home and figure out how to support them. This is also a really strong, interesting career if you're interested in working with a really diverse range of people. If you want to be working with older people, younger people, working in the home, working with people that may have went through a stroke or similar to get them back on their feet and really, really supporting them to improve their quality of life as much as possible. This is also a great course if you've got really, really good communication skills. You're working with potentially really vulnerable people at some of the most vulnerable times in their lives. But if you know, I'm really good at that, like I can work with people, I can chat to people, I can empathize, then a course like occupational therapy can be great for you. This is a course that probably fewer of you have heard of, healthcare science. So you might think that healthcare science sounds like it's neither healthcare nor science, but actually it's getting to use a little bit of both. So it's quite a scientific course, but it's focused on working within a clinical environment, within an MDT, to focus on specific diagnostic tasks. Healthcare scientists often focus in a specialization in a specific area, and we have two specialization routes at City St George's. Firstly, you can work in cardiac physiology and become a cardiac physiologist within the NHS. Be focusing on the heart and making sure you're able to diagnose within hospital environments any sort of heart conditions. We also have a sleep and respiratory stream. So here you get to focus more on any respiratory issues, including any sort of longer-term asthmatic or similar issues. Healthcare science is really great if you're interested in using all of those scientific skills, but you want to be at the front working with patients every single day. Most people don't know this, but the vast, vast majority of diagnoses in the NHS have a healthcare scientist involved at some stage, whether it's them taking your blood pressure, whether they're using an ECG, whether they're working just with the doctors to better understand a patient and their conditions. This can also be a really great way of getting involved in a specific area really, really quickly. The healthcare science degree is only 3 years. You'll spend half your time on placement. And then once you finish, you can get a job as a cardiac physiologist. You're working within that MDT as soon as you graduate. So you're able to work with patients and with doctors from really early on, much more quickly than the sort of 5 years plus that it takes to get through medicine. I mentioned this one a little bit earlier, but just to sort of clarify what's the difference between diagnostic radiography and radiotherapy. Sometimes this course is actually called therapeutic radiography, so keep that in mind if you're looking at a different university where it might have a slightly different name. Radiotherapy is really focused on actually treating patients and using various tools in order to do that. Radiotherapists generally work with patients that have cancer or a similar condition, and they're often part of a wider oncology team. In terms of radiotherapy, one thing that's amazing about it is you are really able to support patients and save lives. At City St George's, we have our VERT, as we call it. It's not the nicest acronym in the world, but essentially it's a virtual environment. You can see here on the top left and bottom left, where you get to see how different technologies and different radiotherapy treatments actually work whilst remaining safe in your training. Again, you'll spend roughly half your time on placements as a student radiographer within NHS trusts. For all of our healthcare courses, we do have placements normally between 30 and 50 weeks over the 3 years, depending on the course. We work really hard to support our students who are on placement. One nice thing is if you apply for most of these healthcare courses, everything apart from healthcare science, you also will likely qualify for the NHS Learning Support Fund. This is a bursary that the NHS provides for home students studying a relevant healthcare course. It's £5,000 a year that you get on top of your student loan in order to support and encourage you to consider these healthcare courses. So physiotherapy, radiography, nursing, midwifery, paramedic, physio, and a bunch of other courses qualify for the Learning Support Fund. And that means you get £5,000 every year as part of a bursary from the NHS in order to support you whilst you're studying, and also, like I said, encourage you to consider these courses. You don't get that with medicine. So again, that's another reason to think a little bit more about studying that course. To find out more about the Learning Support Fund, just Google it and go on the NHS Business Services website, where you'll be able to see exactly who qualifies for it and everything that that involves. In terms of where our placements are, lots of them are at St George's Hospital itself, but we also have clinical placement partners all across London and the surrounding areas. So we've had students on placements at Great Ormond Street Hospital, Royal Brompton. As we mentioned earlier, paramedics go out with the London Ambulance Service, and physios might go out in sort of non-clinical settings like schools or sports clubs. So there's a really wide range of placements. And again, because we have a dedicated healthcare and science campus, we can really focus on supporting students whilst they're on placement and understanding what they're sort of going for. In terms of teaching, the rest of our teaching is all delivered in-house, so at our main campus. We really focus on simulation because it's been proven to be really effective in training and developing prospective healthcare students. We're really big on being practical and clinically focused, and so you'll be getting hands-on learning right from the start. If you want to be sitting in lectures 2 years, then City St George's isn't the uni for you. It's really practical and hands-on. I mentioned this all earlier, that we have immersion rooms, we have replica ambulances, we have X-ray simulation suites, or VERT, as well as treatment planning software systems. The idea behind this is it emulates what sort of job you'll actually be doing before you go out on placement. So you have that support whilst at university before you head off onto placement. So that's a lot of information about our healthcare courses and about healthcare in general. The other option, if you've thought about medicine and you've thought, oh, I really like science, maybe I've gone to medicine, but actually I don't really like the idea of being in healthcare or working in the NHS, then the alternatives that you can think of are our science-based courses. So we have 2 science-based courses currently at City St George's Tooting. The first one is our biomedical science course. So this course focuses on giving you a really broad understanding of everything to do with the human body, understanding disease and health, and how to investigate, diagnose, and treat this as a sort of scientist. So it's not patient-facing. You're not going to be going out on placement. Instead, you're doing all of that science. Perfect for someone who's really loved biology and chemistry at school, but maybe you're not as interested in actually being a doctor or being in that MDT. One nice thing about our biomed course in particular is you do get to work in the St George's University still, City St George's University, in that sort of healthcare environment. So even though you're doing a science course, you're surrounded in this clinical environment, and so you get to see the impact of that science from day one. We also have an integrated master's course. It's currently the only integrated biomed master's in London. So if you do want to sort of specialise or get that higher level qualification, you can get that with us. We also have different pathways, so you can go into a specific area of biomed if you're interested. And we have an optional placement year, what we call professional training year, where you can actually go out and work with one of our professional partners. That could be in a pharmaceutical company, could be in a lab, it could be in a hospital, sort of working with other biomedical scientists. And we also have a really big focus on career support. Whether you decide you want to go into medicine afterwards and go a grad medicine course, we have support for that. Or if you want to get a job in research or pharmacology, we have that sort of support there to get you on to your next step, whatever that might be. Lots of students join our biomed course planning to go on to medicine afterwards, and lots do go on to medicine afterwards and are often very, very successful in doing so. Lots also don't, and often that's because they've decided whilst they've been in the course that actually they don't want to study medicine anymore. They're more interested in pharmaceuticals or research or working in a specific area, maybe related to medicine, but not as a doctor. This can be a great option if you're a little bit unsure about medicine, you want to get a bit of related experience whilst you're studying, but you want to keep that door open in the future so you can go into graduate medicine. The other course that we have, the other science-based course we have, is clinical pharmacology. This is quite a specific course that probably most of you haven't heard of before. But again, it's kind of similar to biomed in some ways, and it's not a placement-based course, but it's really, really focused on drug development and also how these are actually used to treat patients. That's where the clinical side comes in. So typical pharmacology courses really, really focus on the early stage of drug development. The clinical pharmacology course is broader than that. It focuses on that development side quite heavily. Then also, how does it get from being made in a lab, if there's a new painkiller, to actually being used by doctors? What is the rest of that process? And so it's really set up to equip you with all of those skills that are really important to succeeding. It's not all about just like being a really good scientist. There are lots of other skills that go into working in the pharmaceuticals industry. And so the course is really set up for you to get those different experiences throughout. We designed this course in collaboration with employers, and so we do have a really, really great employment rate for this course and also have plenty of work experience and research projects throughout. One of our students just got back from Spain, where they've been working in a lab for 6 weeks as part of the Turing scheme. So there are options to study and actually work whilst you're on the course in lots of different sort of environments. In terms of the career options, I think often people worry with science courses that they don't have a set career in the way that medicine, paramedic, physio do. But actually, it means that you have a really, really wide range of options afterwards. I've mentioned a couple of these already, working in like the pharmaceutical industry, working in clinical research or scientific research. There's also loads of others that you probably wouldn't have thought about. Law firms are often desperate to hire scientists that understand different specific areas to come and sort of advise and work in these areas within the law. Lots of people work in IP, so intellectual property or copyright. Lots of people work in government, focusing on scientific policy. We actually have a couple of the big sort of scientific advisors in the UK studied or taught at City St George's. And so this can be a really great way to sort of progress into public health or something linked to that. Lots of our students go on to work in the civil service, so actually working for the government, but in maybe a non-policy role in a sort of specific area to help understand. And then the big thing I mentioned earlier is you can go on to further study, whether that is becoming a doctor via graduate medicine, whether it's becoming a dentist, whether it's becoming a physician associate, through our MPAS course. There's lots of different options that you can do after that science degree. Now, the nice thing about allied health and science courses is the application process is that little bit shorter and that little bit less competitive. Still really important that you understand the course you're getting into, but that clinical work experience isn't as key as it was for medicine. If you get the option to do work experience, please do it, but it's not necessarily required in order for you to apply it to the course. The UCAS deadline is a little bit later, so it's around the middle of January. We anticipate this year will be the 14th of January. You still need to match our entry criteria, submit a personal statement, and get a reference. We'll go through the entry criteria in just a sec. For allied health courses, we do still have interviews, and these are still really important in helping us understand if you're well suited for the course, especially for those skills that your A-levels or equivalents don't test. So again, communication, empathy skills that I mentioned earlier. For Biomed and Clin Pharm, there are no interviews, so it's more about your personal statement and also your general grades. And then you get an offer that will be conditional on those grades. So like I said, it's that little bit simpler of an application process that you want to apply for. And as we can see on the next screen, the A-level grades are a little bit lower. So generally, they vary from 3Bs to 2Bs and a C, depending on the course. This can all be found on our website. There are no secrets here, so I'm not going to spend too long going through each one of these. But again, this is good for you all to know if you are thinking, oh, well, I'm not going to get those 3As that I need to get in for medicine, but actually, I've done biology and chemistry and I've got 3Bs, so maybe I should consider healthcare science. It's important to say here that our contextual offer also applies to these grades. So if you qualify for our contextual offer, you can take down your average grade by two letter grades. So if you qualify for our contextual offer and you were applying for diagnostic radiography, your offer would be BCC rather than BBB. Similarly, if you applied for Biomed, normally it's BBC, that could go down to CCC. So it goes a little bit lower as well. We do have specific GCSE requirements for each of these subjects as well. Do make sure you qualify for any of those before you think about applying. Now, before we wrap up, one of the last things I want to talk about is clearing. So as you all might know, every university generally has courses that go into clearing every year. This is later in the application process over the summer before you start, and it's for courses that, for whatever reason, we have a few gaps remaining. Often that may be because people missed their offer, have decided to go to an alternative university, or have decided to enroll in an alternative course. These are the relevant healthcare courses that we anticipate, although it's not guaranteed, maybe in clearing come August, come A-level results day. In Tooting, we could have Biomed, Clin Pharm, Healthcare Science, OT, Paramedic and Physio, all courses that we've discussed today. And at our sister campus in Clerkenwell in central London, we anticipate there might be a couple of different courses. Again, these aren't guaranteed, but could include nursing, midwifery, psychology, which you didn't get a chance to talk about today, and also an introduction to health sciences, especially if you've got slightly lower grades. The process for clearing is a little bit different than the process in the main cycle, but the main way to find out more is to go on our website and you'll see our FAQs and all the courses that we have available. And also join us for another webinar next week where we'll be going over clearing in a little bit more detail so you are able to apply if you're interested. So we're going to wrap up with some final thoughts and hopefully some big takeaways that you all can use, whether you decide to apply for medicine, an alternative course, or take a different path entirely. The first thing I'd really recommend is do try and reflect on which course you're sort of considering. Even if you thought you want to be a doctor since you could walk, think about what that actually means for you and why you're well set up for it. If you're thinking about becoming a doctor, it's really, really important that you actually consider why you want to go into that and understand the negatives. It will make you more successful in writing a personal statement, and it will make you a better interviewer. And it might make you realize that maybe the course isn't for you, and that is fine. We've gone through so many alternatives today, so many other incredible courses and careers that you could consider undertaking. It's worth thinking about placements whenever you're reflecting on courses, whether it's with us or anywhere else. Is the placement in an area I can get to easily? Am I sort of excited to go for placements there? Remember, for all those healthcare courses, half your time is actually out and about. So it's important to understand where the placements are and what you'll sort of be involved in doing there. I think it is really important to think about your career. Lots of people go into medicine not actually thinking about the fact that that means that they've got further training afterwards and that they will be a doctor later on. So you want to keep in mind exactly what you might want to go into afterwards and not narrow down your options too much. Some of our students end up studying biomed because they want to keep their options open. They're thinking, maybe I want to go into medicine, maybe something else. I'll do biomed, and then if I still really want to become a doctor, I can always do graduate medicine a little bit later on. Do you ever think about where you want to go afterwards, and also what you kind of want your life to be like? Are you focused on work-life balance? Would you rather be like committed to your career? Do you want to work in a sort of high pressure environment, or would you rather work in a diagnostic environment? There's lots of different ways that you can sort of figure out exactly where you want to go afterwards. Just to finish up, we have some final resources here. It says it's for aspiring medics, but hopefully it'll be useful for sort of everybody, with some further reading that you can do, especially if you're missing that really important work experience, and some other resources that you can take a look at, including some virtual work experience that's free of charge, organised by the Royal College of GPs. Do scan this and have a little look. While you're doing that, at the bottom, I'll just mention that we also run some specific widening participation activities. So this is for students who, for whatever reason, might need a little bit of extra support in applying to university. We have an upcoming lecture focused on a nurse that's worked at St George's that has just published a book that's happening in a couple of weeks' time that we'd really recommend you go along to. Be a great way of you sort of adding to your personal statement. And again, better understanding the MDT, the role of doctor, and the role of different healthcare professions. To finish up, just two other links for you all to look at. The first one is the NHS Healthcare Careers website. This goes through all the different careers on offer in the NHS, and it also has a really excellent careers quiz where you can fill in what you're sort of interested in, what motivates you, what sort of career you want to have, and it will recommend set careers and how to progress into those. The NHS Health Careers website is also great in just understanding all of the different pathways into medicine and into healthcare in the UK. The last thing to mention is the GMC website, so the General Medical Council website. That's a really great place to look to, again, better understand the duties of a doctor, to understand what you're getting yourself in for if you're going to apply for medicine. This is also some of the information that we use in setting our interview questions. So if you are going to apply for medicine, understanding those duties of a doctor will set you up really, really well to answer any sort of specific questions that are asked at the interview and just show off all of your attributes and skills that we require in a medical professional. Hopefully that was useful for everyone. I am happy to take any questions that people have, but like I said, we also have our online website where you can chat directly to students about their courses and their experiences studying medicine or whichever